Namaste everyone, I am Dr. Leena Yadav and once again we are here on this platform to discuss IVF, its details, the plus and minus around it and your apprehensions. So we were discussing in our previous videos regarding what happens when you visit a fertility specialist, when you visit a fertility clinic and the doctor shoots you with so many questions, and why does the doctor give you so many questions. So further on that, we were discussing last time that the investigations which we tell you to do on day 2 of the menstrual cycle like FSH, LH, AMH, prolactin, thyroid, a day 8 HSG. By HSG we mean a hysterosalpingography. By hysterosalpingography we mean that we do a tube test for you to find out whether you have patent tubes or not. So further going on that, when you visit a fertility expert, on further examination and further question and answers, the doctor would ask you that what has been your previous history? Have you got any fertility treatments done previously? So fertility treatments are like IUIs, IVFs, or you have undergone a donor egg treatment, or somebody has advised you to go for a donor egg, or you have taken a donor sperm. So these details are important when we ask you, because if you are a patient who has undergone IUIs, 3 IUIs, 4 IUIs, 1 IUI failure, it holds a lot of significance for us to understand that what is your present diagnosis, what are your hormones, and based on that, whether what kind of treatment we have to recommend you. If you are a person or a couple who falls into the category of going for further IUI cycles, we might recommend you to go for further IUI cycles. If the hormones which are present with you or your partner suggest that we cannot waste your eggs or your sperms on further treatments like IUI, which have definitely got a lower success rate, then we would straight away tell you to go for IVF. We also ask you the history about the previous surgeries which you have undergone when you were struggling with your fertility. By previous surgeries, we ask you whether you have a history of laparoscopy, whether you have a history of hysteroscopy in the past, or why was the surgery done? Do you have history of fibroids, or do you have history of endometriosis, or the doctor did multiple IUIs for you and you were not able to conceive and the doctor told you to go for a diagnostic laparoscopy. So this holds importance for us when you tell us your history that yes doctor, I have done these surgeries in the past. First of all, if you have already undergone those surgeries, we shall not repeat it again. Second, the findings which are there in that surgery hold very important information for us, which helps us to understand what should be our plan of treatment. Thirdly, the findings in those surgery help us to formulate a plan whether you are a candidate for IUI or you are a candidate for IVF, or we can simply manage you with some oral medicines, form your egg and tell you as a couple to have a timed intercourse. So for that, the importance of the history of previous treatments, previous surgeries is very important. Now, further on this, we also ask you about what were your previous hormonal evaluations. So by hormonal evaluations, I mean if you have any previous reports of your FSH, LH, AMH, prolactin, thyroid, your other things like your any genetic profile. That is important to us because if those parameters are fine, we need not worry. But if those parameters have deteriorated with the present situation when you are coming to us, it again helps us, or we have to analyze that what should be our plan of treatment. Many a times I have seen that if I tell my patients that I would like to repeat your tests, my patients get annoyed with me that ma'am, we've just got the test done 1 year ago. No, my dear couples, any evaluations which have been done within 6 months for an infertile couple can be considered. But any evaluations which are more than 6 months apart cannot be considered because fresh evaluations help us to understand and also help us to formulate a plan of treatment for you. Thank you so much, and we would further discuss that what else the doctor asks you and why does the doctor ask you all these questions. Please be with me for my further videos.